All right, let's just get right into it. If you're a parent, you watch your kid with this mix of just wonder and, yeah, a little bit of worry. But what happens when that little worry starts to get a bit bigger? When you've got this gut feeling that maybe, just maybe, something's going on that you can't quite put your finger on? If that sounds familiar, well, this is for you. And listen, that feeling, it is so real, and you are definitely not alone. It's that 3 a.m. Google search, right? Lying awake, typing in symptoms, trying to connect the dots, trying to make sense of things that the parenting books just don't seem to cover. This is all about taking that uncertainty and turning it into real, solid understanding. And this isn't some rare, abstract thing. Here's why this conversation matters so much. The CDC says that autism spectrum disorder affects about 1 in every 36 kids in the US. I mean, think about that. In your child's classroom, on the playground, in your neighborhood, there are families navigating this right now. It's a huge part of our community, and the more we all understand, the better it is for everyone.
So, yeah, that's the big question, isn't it? Your gut is screaming that something's different. So, where do you even begin? How do you take that nagging feeling and turn it into something clear, something you can act on? Well, it all starts with understanding what you're really looking at.
First things first, we've got to get past all the stereotypes. It's not like the movies. It's not about some genius who can count cards. The reality, it's so much more nuanced and so much more human than that.
Okay, here is the absolute most important thing to get right off the bat. Autism is not a disease. It's not a flaw. It's what's called a neurodevelopmental condition. The best way to think about it, it's just a different kind of brain wiring. And that word spectrum is everything, because it looks completely different in every single person. So when clinicians are looking at a diagnosis, they're looking for ongoing differences in 2 main areas. On one side, you have social communication and interaction. This could look like finding it hard to read body language or taking things really literally, or maybe just struggling with that natural back and forth of a conversation. Then, on the other side, you have what are called restricted and repetitive behaviors. This could be anything from an incredibly deep, passionate interest in one specific topic to a real need for routine and for things to be the same. It can also include repetitive movements, like hand flapping, which you'll often hear called stimming.
All right, now before we go any further, we have to talk about the myths. It's so important we clear away all the misinformation out there because it causes so much pain and confusion.
So let's be crystal clear. Autism is not caused by vaccines. That whole idea came from a single, fraudulent study that has been totally debunked. It is not the result of bad parenting. That awful refrigerator mother theory was just cruel and wrong. It's a lifelong neurological difference, not a mental illness that kids just grow out of. And this one is huge. It is not a lack of empathy. In fact, so many autistic people feel empathy incredibly deeply, they just might express it in ways that are different from what we're used to. Okay, so if those are the myths, what are the realities? Let's zoom in on the earliest signs, because if there's one thing we know for sure, it's that getting support early on can literally change a child's entire life.
Let's walk through this timeline. See that first one at 9 months, joint attention? It sounds kind of clinical, but it's actually fascinating. It's that moment when a baby looks at what you're looking at. Like if you point at a dog, they look at the dog too. It's about sharing an experience. That's a fundamental building block for social connection. And then you see other things, like responding to their name by their first birthday, or using simple 2-word sentences by age 2. Now, a delay here doesn't automatically mean autism, of course, but it's definitely a good reason to have a chat with your pediatrician.
But what if the signs aren't so obvious? This brings us to a really important topic, especially for a group that has been systematically overlooked for decades: girls. You see, the way we've defined and looked for autism was based almost entirely on studying boys, and that means we've been missing it in girls, a lot.
And this is what that looks like in the numbers. Right now, boys are diagnosed about 4 times more often than girls. But here's the thing, experts are now pretty sure that this doesn't reflect how many autistic girls there actually are. It reflects our own failure to see them. We've been looking for one specific presentation of autism, and we've missed a completely different one.
And a massive reason why is a behavior called masking or camouflaging. Think of it as a social survival strategy. It's when someone consciously or even unconsciously hides their autistic traits just to fit in. This might mean forcing eye contact even when it's uncomfortable, or carefully copying how their friends talk and act, or pushing down the urge to stim. And while anyone can mask, the research shows that girls, who are often socialized from a young age to be more agreeable and accommodating, tend to do it more often, and frankly, they get really good at it.
And while that might help a kid get by on the surface, You have to understand, this constant performance, it comes at an enormous, devastating cost to their well-being.
And you can just see the ripple effects here. This massive effort leads to this deep, chronic exhaustion. It can lead to something called autistic burnout, which is a state of complete shutdown, and it's linked to incredibly high rates of anxiety and depression. And because these girls look like they're doing okay on the outside, they often don't get the diagnosis and the support they desperately need until they hit a total crisis point, sometimes not until they're teenagers or even well into adulthood.
Okay, so you're taking all this in. You have these concerns, you understand the basics, you know that some signs can be hidden. So, what do you do? Right now, how do you turn all this worry into actual answers?
First and foremost, you have to trust yourself. I mean it. Study after study shows that when a parent is concerned about their child's development, they're usually right. You are the world's leading expert on your child. Period. If something feels off to you, it is worth looking into. Even if well-meaning friends or family are telling you, oh, don't worry, they'll grow out of it. So here's the game plan, the roadmap. Step 1, talk to your pediatrician. Straight up, ask for an autism screening. Step 2, go into that appointment ready. Write down a list of specific things you've noticed, real examples. Step 3, if that screening doesn't answer your questions, you have to push for a referral to a specialist for a full, comprehensive evaluation. And then step 4 is that full evaluation, which is usually done by someone like a developmental pediatrician or a child psychologist. I know it can feel like a process, but this is the path to getting a truly clear picture. You know, the idea of getting a diagnosis can be really scary. I get it. But it is so important to reframe what it means. It's not some label that's going to limit your child. Think of it as a key. It's the key that unlocks understanding. It unlocks support that's actually tailored to them. It's the key to getting them what they need to thrive. It's just information, and information is power. And that brings us to, honestly, the most important part of this whole conversation: hope. What comes next? Because a diagnosis isn't an ending. It's the beginning of a whole new journey, one that's filled with support and growth and just incredible potential.
If you take one single thing away from decades of autism research, let it be this: early intervention changes lives. Getting the right support in place as early as you possibly can, it makes a dramatic, profound difference in communication, in social skills, in just daily life. It is the single most powerful tool we have. And look, there is so much evidence-based support out there. You'll hear about things like speech therapy and occupational therapy, which can help build all sorts of practical skills for everyday life, or other approaches that focus more on social communication and play. But the goal of any good therapy, any good support, is never to change who your child is. It's about giving them the tools they need to navigate a world that, let's be honest, wasn't really built for their brain.
And please, just let this one sink in for a second. Your child is not broken. They are not a puzzle that you need to solve. They are a whole human being with their own incredible way of seeing the world. Your job isn't to make them normal. Your job is to understand their world and to help them build a wonderful life within it. And really, in the end, it all comes down to this. Your child has something amazing going for them. They have a parent who cares enough to look closer, to ask the tough questions, and to fight for them. Your job is just to see them, to really see them. The journey starts right now. So, are you ready to look?